One of the other areas where focus shockwave can be particularly helpful is often treating around some of the bony enthesis. So the Achilles tendon enthesis can be a difficult area to treat with radial shockwave because of that mechanical irritation. The same such as the lateral epicondyle. So some of those bony areas, we often get from feedback from clinicians that there is a cohort of patients that it's just too sensitive to treat in those areas. Focus shockwave is often a really good opportunity where you're able to expand and to able to treat more patients who may not tolerate the radial. So once again, what I'm going to do, if I'm treating someone with insertional Achilles tendinopathy, I'm also going to treat through the calf just as I've done there. I'm going to make a mark again where the tender areas are, and it's really important to palpate these because it does not always correlate with exactly where on the X-ray or the MRI or the ultrasound exactly where that pain is. So it's really important to have a bit of a feel through the tendon and make some marks where our patient reports maximum tenderness. So again, we're going to use the small standoff because in this area, it's a very superficial indication. Placing some gel on the area. I often find when you're treating around a bony area, because bone is quite reflective of either ultrasound or shock waves, you get more energy being dissipated into that tissue, so it can be more sensitive. So what I'm going to do is start again slightly away from the area of maximum tenderness, and I'm going to then work towards that. Okay, perfect. So I'm going to start on a really nice low setting through there. Change my impulses down. We're going to place our applicator onto there, hit the start button on the machine. That's then going to allow us to then activate the shock waves through here. So I'm going to start to slowly work towards those areas that are where there is pain from our clinical assessment and delivering shock waves into that area. Now, as with all treatments, I'm constantly talking to our patient, asking for that feedback and slowly adjusting the settings depending on that. So the really helpful thing is on the handpiece here, I can increase the pressure as we go through the treatment. How is that feeling in terms of 1 to 10 discomfort, Marco? Okay, so not even 2. So we're able to increase that energy higher. And what you'll find is very similar to radial shock wave. When we're on an area where there is pain, we're going to get an increase in sensitivity in that area. And after about 20 to 30 seconds, you're going to notice that we're going to start to see that pain dissipate. So what might be a 5 out of 10 when we're initially on there is going to drop down to be a 2 or a 3. And that allows you to either increase the intensity or also treat some of the other areas through there. So in general, I'm going to deliver often 2,000 impulses to the plantar heel and a similar amount of impulses to the Achilles insertion. When I'm treating, for example, the mid portion of the Achilles tendon, I find that that's really well tolerated with radial shockwave. And because we're treating such a diffuse area, my go-to is often radial shockwave for these mid portion tendinopathy cases.